Mental health really does matter, and AUB has been a leader in Lebanon and the Arab world for some time in this regard. Because it matters, and it matters a great deal, AUB is launching this University Mental Health Council in order to make support for the community better and wider reaching. This new widened scope intends to provide support for faculty and staff at the university so that they receive the same care that students have been receiving. The University Mental Health Working Group, co-chaired by Dr. Maalouf and I, brought together an amazing and dedicated group of professionals. One of the early achievements is that we have a clinical psychiatrist on site in West Hall to strengthen the bridges between campus and AUBMC, which is one of the critical aims of this Mental Health Council.
So there was a needs assessment, and then we came up with a strategic action plan. The needs assessment included mapping the existing services, interviews and focus groups with students, faculty members, and staff, and the review of existing policies. Our strategic action plan enhance the existing general prevention efforts and improve the coordination. There was some, but they needed to be better coordinated. Focus on developing secondary prevention initiatives, again here taking into account the vulnerable groups on campus, and increasing service capacity. So I'll end with the mission of the Council. So our mission is to develop a comprehensive mental health strategy for AUB and AUBMC that caters for the mental well-being of the AUB community, including staff, students, and faculty.
What a wonderful celebration on a timely initiative, particularly on World Mental Health Day 2020. For centuries, people recognize mental illnesses, but unfortunately, the general public stigmatized such patients. And what followed was a social taboo that hindered many subjects from stepping forward, seeking the medical help they need and deserve. It is estimated that 1 in 4 people in the world will be affected by a mental illness at some point in their lives. Moreover, mental health conditions account for 16% of the global burden of disease and injury in people aged 10 to 19 years. AUB is privileged to have a large and diverse group of mental health professionals on its campus, be it in the departments of psychiatry at the Faculty of Medicine, the Department of Psychology at the Faculty of Arts and Sciences, the School of Nursing, Faculty of Health Sciences, and others. Moreover, the Office of the Student Affairs has recognized over the years the importance of reducing the mental anguish and suffering of students because of illness by providing the necessary care, advice, and attention.
It's a special launch of a critical initiative. Mental health is really one of the most challenging, intractable issues, I believe, for this century, but it's been one of the most intractable issues for many centuries. Like cancer, it's a disease that needs to be treated. We all have challenges in this life, but some have more serious challenges than others. So we are privileged to serve those less fortunate and those who one day may be able to serve many, many people who they might not have the opportunity to if we don't extend that helping hand today. But we're all working to make life better, to create opportunities to care for individuals who are struggling and who can become great human beings and great leaders.
AUB Mental Health Matters, as you've heard it. This statement is now more accurate than ever in light of the recent turmoils, and the past year was particularly challenging for everyone. It was unbearable emotional roller coasters every day. This roundtable discussion would like to capture our collective experiences. It's about our lives as persons and our roles as different professionals at AUB, to try to reflect on this experience and to try maybe to suggest future development, what the council can do later for AUB community.
The main focus should be honestly responding to psychiatric emergencies and mental health emergencies. So far, we've been in the response cycle for over 1.5 years, and we haven't had any chance neither to recover and nor to mitigate or plan for future disasters. And this all started back with the financial collapse, which affected everyone, including staff and faculty, and students also.
We have had to relook at the way we live and the way we teach and the way we provide our services. And I think the first thing was within the, as faculty, as educators, having to move virtually to online teaching. I think this has been quite a challenge. It was exciting for some, a bit less so for others, but I think it taught us new ways to think of our courses, our materials, and the way students learn. We realized really that our role is not only to educate, but also to support and mentor. And this is at the level of at the academic level, but also at the personal level. The work-life balance is not a luxury, it's a must to be able to sustain what we do and how we do it.
The stress will never disappear, but what will change is how we handle it, how we deal with it as youth.
We're living with the stress of online teaching, delivering our tasks and duty for the jobs, but with our salary being up at the end of the month. So, but you know, we're trying our best. The Dean has done and has opened the dialogue with the staff members. We are doing our best to help them. We've created a WhatsApp group that can help and support them in any areas. We've also, the Dean has taken the time to even do weekly meetings with the staff of any concerns they have, so they know we are there and try to help them because everyone is stressed in this period.
At the counseling center, it was important to us to make sure that we're accessible, to keep the legacy and the heritage that we hold at the counseling center, to be accessible and available to students. Given all the challenges that we face nationally, we tried our best to be present on campus at all times, to be available after hours for students, and sometimes opened up the floor for faculty and staff to seek services at the center. We're trying our best to be there. The next phase was challenging with the lockdown and the pandemic because it affected service provision greatly. We had to switch services automatically to a virtual format, something that requires a great deal of training, something that requires a great deal of service excellence. The uncertainty is a major key theme identified where it's building up anxiety for students, faculty, and staff alike. And this uncertainty, the stress and anxiety are challenged also by the new experiences of individuals that adds the additional stress, like online teaching and learning and virtual services.
It's time for us to show solidarity. This is the basic. It's not sophisticated. It's not complicated. And even if we are mental health professionals, we need the support of our colleague also.
Hospitals are stressful workplaces, and we want to make sure that we are caring for our caregivers, as we said. We teamed up with the Psychiatry through the Employee Assistance Program, be it individual sessions or group sessions, and having it within employee health decreases the stigma a little bit, so that people are not that concerned about the taboo. So that helps our employees a lot.
So my major coping strategy is balancing this acceptance and change. What do I accept and where do I push forward? We're here to help everybody tailor the services to their own needs, and I think that's the key thing that we developed together.
Very basic research activities had to be paused. We had to think about the welfare and the safety of the field workers in the field. We had to prioritize their health, their safety, and also there was a shift in the priorities as well. So when we were dealing, for example, with primary healthcare centers as our catchment area, obviously the primary health centers had other priorities now, so the kind of research that we were conducting had to be paused for a little bit. Many of the experiences and thoughts and emotions that we are experiencing change on a daily basis. So for example, if I go in as a researcher and collect data, let's say this week, or let's say I collected data on July 30th. August 4th happens,
all the data becomes obsolete because all of the mental health emotions and experiences have changed within a 5-day period. New collaborations, so we've, by writing new grants with new stakeholders, and also I think it's wonderful just being able to work within an environment. At least I know I'm working in a very supportive environment in my department and my faculty, and so all that actually helps a researcher continue with their, with their mission to continue research. Yeah.
Our teams are very supportive, so which is wonderful. So we live in a supportive environment, although we can perceive a lot of stress among us.
We need to be able to provide as much support as possible for students, staff, and faculty. I truly believe there will be better days.